Hello, my name is Dr. Dewan S. Raja. Today I will discuss about diverticular disease. Diverticular disease includes diverticulosis and diverticulitis. What is the diverticular disease? This disease is characterized by diverticula, and the diverticula are the herniations of the mucosa and submucosa of the intestinal wall through the muscular layer that frequently involve sigmoid colon. These are not true diverticulum, these are pseudodiverticulum because it is the protrusion of mucosa and submucosa through the muscular layer. So all the layers of the intestine are not covering the diverticula. So the true diverticula is the Meckel's diverticulum, but colonic diverticulosis, these are actually pseudodiverticulum because only mucosa submucosa is pushing out from the lumen of the colon. Diverticula are almost always multiple and are common among old people. Diverticulosis, having multiple diverticula, frequently asymptomatic. About 50% people over the age of 50 has diverticulosis. These are asymptomatic. There may be some vague discomfort seen among the people who consume low fiber diet. So it is more common in the people of Western society, okay, if they have low fiber diet. Diverticulitis means inflammation of the diverticula. So this may be asymptomatic year after year, and this is acute condition, diverticulitis, inflammation of the diverticula. It may heal by itself or it may go through complication like perforation, peritonitis, abscess. So what is the cause of diverticulitis or diverticulosis? Inflammation is colitis. Diverticulosis means the diverticular formation. The cause is unknown, may be caused by colonic dysmotility, defective muscular structure, defect in collagen, and aging will get diverticular formation. Once the diverticula is inflamed, then we'll get diverticulitis. Itis means inflammation. So cause is unknown for the diverticula. For the diverticulosis may be caused by colonic dysmotility. Signs symptoms of diverticulitis: lower left quadrant pain. If we divide abdomen into 4 quadrants, then the left lower part of the abdomen is a site of pain and tenderness on palpation. Nausea, vomiting, fever, diarrhea, and dysuria. Abdominal distension, tympanic on percussion, lower gastrointestinal bleeding. Okay, so pain, the left lower part of the quadrant of the abdomen, tenderness on palpation, nausea, vomiting, fever, diarrhea, dysuria. This may happen sometimes. The lower part of the sigmoid colon or rectum may irritate the bladder, urinary bladder. There may be sinus tract formation. So the urinary bladder may be inflamed and we may get dysuria. Abdominal distension, tympanic on percussion. Okay, that may happen if there is little perforation. Lower gastrointestinal bleeding is also an accompaniment of diverticulitis. So again, diverticulitis is the inflammation of the diverticula. Okay. So here, diverticular disease, diverticulosis, diverticulitis. Here is the diverticula. So mucosa and submucosa goes out, okay, through the muscular layer, and this is the diverticula here, containing the fecal matter here, fecal matter that may be obstructed here, and there may be congestion, and there may be perforation here. Okay, we have multiple diverticula, and sigmoid colon is the most common site for diverticulosis, but it may happen in any part of the GI tract. But sigmoid colon is very important site, is the most common site of diverticular disease. Okay, this image has been taken from Robin's pathology. We are looking at that. Stool-filled diverticula. These are stool in the diverticula. Okay, that present regularly, and cross-section showing outpouching of mucosa beneath the muscularis propria. That is this. Okay, so there is diverticula, a depressed part going out. Okay, here photomicrograph of sigmoid diverticulum showing protrusion of mucosa and submucosa through the muscularis propria. Like this is mucosa, this is submucosa, it is pushing towards there, okay, through the muscularis propria. Okay, so how can you diagnose diverticular disease, diverticulosis, diverticulitis? Diagnosis is CT scan of the abdomen. Colonoscopy should be avoided during acute diverticulitis. It may create problem. If it is settled down, then we can do colonoscopy also. Treatment of acute diverticulitis, nothing by mouth, intravenous fluid, antibiotics, surgery if indicated. Okay. Treatment of asymptomatic diverticulosis, high fever diet. Okay. So treatment, nothing by mouth, intravenous fluid, antibiotic, surgery if indicated. When indicated? When medical management fail, antibiotic does not work. Repeated diverticulitis, there is stricture formation, obstruction formation, and the site of spread of infection, then the diverticular part should be taken out and healthy part should be anastomosed to each other. Okay. So we got that here. Diagnosis, CT scan of the abdomen. Colonoscopy should be avoided during the acute diverticulitis treatment. Nothing by mouth. Intravenous fluid, antibiotic, surgery if needed. That should be determined by the surgeon. Treatment of asymptomatic diverticulosis, high fiber diet. And that's all about diverticular diseases. If you have any question, please feel free to ask me. Please share the information with your friends. Have a nice day. Bye now.